In this video we'll discuss about cholelithiasis. So cholelithiasis, you know very well, the cholelithiasis is nothing but the formation of the gallstone in the gallbladder, right? And what happens if there is a gallstone in the gallbladder? That causes cystic duct obstruction, right? Good, excellent. So in your examination, try to look for a patient more than 40 years old, obese, female, multiparity, okay, or a patient using what you call is on a total parental nutrition TPN, or any oral contraceptive use OCP, okay, or any family history of what you call cholelithiasis, diabetes mellitus, okay. And if there is any recent rapid weight loss, then they can present with cholelithiasis. So try to remember these are the important risk factors, okay, that usually the patients of cholelithiasis presents with. So if you talk about the how the patient will present, the clinical features is, look in USMLE, that can be two things. One is either they are asymptomatic or symptomatic. If they are asymptomatic, no need to treat, okay, remember, no need to treat. If symptomatic, then you have to go ahead with the treatment. If symptomatic, what are the presentation, what are the clinical features, what are the signs, what are the symptoms? These are really very important because you need to distinguish cholelithiasis from other diseases of the abdomen, right? These patients with the cholelithiasis, they have the postprandial abdominal pain. Remember, postprandial abdominal pain. And if you ask me where is the abdominal pain located, it's in the right upper quadrant. Remember, right upper quadrant, okay. And the patients will have vomiting, nausea, indigestion, flatulence, okay. And if you try to palpate the right upper quadrant, there will be a tenderness. So these are the really very important. So if you take out what you call you can what you call x-ray, right? The x-ray, if there's a pigmented stones, you can see that because of the high iron content from the bilirubin, remember, okay. And even you can take the ultrasound also, right? So what is the treatment for this? Is a dietary modification. Remember, dietary modification, decrease the fatty food intake, okay, right? And you can use bile salts, right? Shockwave lithotripsy, cholecystectomy, okay. If there is severe, the patient is unbearable, it's not curable by the medical means, then you have to go ahead with the cholecystectomy, okay. And what are the complications if you don't treat it? Is recurrent stones, acute cholecystitis. This can lead to the infection around the stone and causes cholecystitis, and that's a really very severe, okay. And even it can lead to pancreatitis. How it leads to pancreatitis, you know very well, okay guys. So thank you so much for watching this video. Take care.